Okay. So, good morning.
Good morning. How are you?
I'm all right. I guess, do you want to just jump in and give a little bit of your background, like where you located, where you work, that type of thing?
Yeah, I would love that. So, my name is Tim Hunter. I am a registered nurse. Prior to being a registered nurse, I worked in human services. Specifically, I worked in a group home setting with behaviorally challenged pediatric residents that had dual diagnoses within the mental health and intellectual disability capacity. And I knew I really liked what I was doing, but I felt like I was kind of like stagnant where I was moving in my career. And I liked how like nurses just like did stuff and they like, got in and they were always like get their hands dirty kind of people and like always like in it. So I went to nursing school. And then when I graduated, I started working on a floor that is like the perfect floor or not a complete like catch-all. Like if we did it sliced, it diced, it did everything. We had a telemetry side, we did adult cystic fibrosis, palliative, hospice,
Wow.
we had general MedSurg. It was very much like that kind of a place where
Yeah.
it was a hectic place to learn, but it was a great place to learn.
Yeah. Sounds like it.
After a year, I went to the Pediatric Intensive Care Unit at the hospital that was next door, where I spent the rest of my time at the bedside. Loved where I worked in the PICU. It was incredible. The nurses there were amazing. Incredible nurse doctor culture there, where we all were, and like RTs too. Everybody, we were like one unit, one team. We rounded together. We did like it was just a really great culture there.
Yeah.
Ended up needing to look at changing my schedule. So I went into care management. I thought I was going to hate it. I was so upset when I left the PICU. Like I literally cried because I was like, I don't want to leave this. And just because of like different like life circumstances, and ended up loving it. And I worked also, then I went into utilization management and I ran an appeals and grievances team for a plan with I had 20 staff under me, and I liked what I was doing, but I also felt like it was a very large corporate company and they ran very well and they did a lot of things very well, but I also felt very stagnant in what we were doing for helping like the greater community. And that kind of got me looking at like healthcare startups, because like this idea of like startups in any capacity, whether it's like the healthcare space, the tech space, a combination of the two, I feel like there is a ton of collaboration that happens there and it's extremely mission driven.
Yeah.
And I stumbled upon this place called Angle Health and I applied with them. I went through all the interview processes, did not get the job. And they called me and they said, we really do, and we're gonna come back. And like everyone's had that happen in a job interview.
Right.
You're like, okay. Well, they did come back.
Wow.
Yeah, they came back.
You're like, see you never. Wait.
Yeah, exactly.
Wow.
And I've been with them since March 1st. And basically what I do for them is I work in a very cross-functional role like you do if you work in any startup, where it is, I do help them with setting up their care management and their utilization management platforms, and also working on developing their system, but a lot of like clinical, like project management, where as we're developing things for our app and for our portals and for product and also marketing and these other things that require that clinical knowledge. I will work like hand in hand with a product manager who really owns the tech piece, and then I'll own like the other part of it, which is really incredible. Yeah, and I love it.
Yeah, that's cool. That's really awesome. I mean, you're a perfect example of all the different places you can go as a nurse. That's I know something that appeals to a lot of people when they get into it, but then I think a lot of people get their first job and then they're like, like fear of the unknown versus what I'm comfortable with and what I know. And so that, branching out part never actually manifests, but it sounds like, sounds like you've really taken advantage of that and like landed on your feet every time, which is really awesome.
So. Yeah, no, it's super exciting. I in that time I also got my CCM, and I actually start my last semester of my MSN on Monday.
Oh, nice. Wow. Then, on Monday, did you say?
Yeah.
Wow. Woo. That's great. Good for you. That's awesome.
Thank you.
I think it's also an important point is that, like, you read any news headline right now and just healthcare in general, like everyone can see that the system is on the verge of collapse. And I would argue that it was probably there before a pandemic hit. The pandemic is just excising it so that everybody could see. And I feel like systems nursing is such an important field right now. And we totally need it to come from the inside out. Like nurses need to be in charge of it, not people up in some high-rise boardroom trying to be like, well, let's try, So I love hearing about little startups like this. I mean, Nurse Deck, we have our own little, patch of dirt that we're trying to spruce up and help nurses from a community base. So I love that there's people like you out there that are really trying to shake things up because it desperately needs it. So
it's so important, I think all those nurses that are still at the bedside, like their job is so insanely important. And for me, like what took me away from there, and it's something that frustrates me sometimes, is I'll have people like I went to school with being like, don't you miss being an actual nurse? And that is such an offensive thing to say to somebody. But it's right. But, to me, like being a nurse is, you're not better or different. It's just like, who are you caring for? And I think when you move into a capacity like Nurse Deck or like I did with Angle Health, I think that the people that you're looking at caring for is the system as a whole. And you have that capacity to like cast your shadow on so much. And I mean, when you do things like this, I mean, it can lead to things like lobbying in Washington and changing really important things that really need it.
Right. I mean, it's healthcare, the broadest of terms of healthcare. There's so much that needs to be changed, but it's such a beast that it won't be possible unless people are taking little, pieces of it from all different perspectives. I think that's the only way we're ever going to come close to making any sort of improvements on it, which is just desperately needed.
Totally. Before I started with Angle, I went to New York for 3 months or 2 months rather. And I did take an ICU assignment for COVID right in April. And that was like the final piece that like taught me like the bedside's not where your career is. And it's not because of how horrific it was.
Pandemic.
It wasn't, scary. It wasn't the sadness of it. It wasn't any of those things. It was more of like a motivator, like go do something that is going to change this. Like,
well, you see where your mind goes in those moments where you're just like, this could be changed. This could be better, And I think a smart nurse follows that intuition and that gut instinct. And there's so many options, like we were just saying, that it's possible to like really follow that and like make money and support yourself. And also, like you said, have like a purpose-driven career, which is amazing.
Thank you so much.
I think what you said something just a minute ago that, anyway, my brain will come back to it. All right, well, let me jump into some of these questions, and I'm sure we'll kind of weave our way through them here. So if we ever get to a post-COVID world, which, I don't know, what do you think the future of nursing is going to look like? I mean, we sort of dipped a toe in already on this.
Yeah, totally. I think post-COVID, to kind of match your point, I don't know if that's ever going to, I think post pandemic kind of circumstance, I hope that's definitely a thing. I think what nursing looks like, I hope what it looks like, because I don't know what I think it looks like, because I feel like there's so many directions that I can go for the better or for the worse.
Yeah.
I hope the way that it goes is that we stop placating nurses and we stop placating healthcare workers with metaphors about being a superhero.
Yes. Oh my God. Yes.
Nobody wants that. Nobody's asking for that.
No more pizza. No more donuts.
Yeah. And that you don't say for night shift, right?
Right.
Yeah. And
we had pizza.
Right. Exactly. Lukewarm pizza is what everyone.
We left all the boxes for you to clean up.
Yeah. I hope what it looks like is that we see the way that our profession has risen to an occasion that is absolutely impossible in some ways. To match something that you've said, this pandemic is not what broke the healthcare system. The foundation was already broken, and the pandemic was that metaphorical big bad wolf that came and knocked the house down. And now that it has been so public, all of these little pieces of our system that are broken, I truly hope that we start to look to nurses for the answer. And I hope to keep accountability on our profession. I hope that as a profession, we stand and continue to be assertive and to speak for ourselves, because that's also very important. We have to, we can't wait for other people to do it for us. That's not going well. We have
That's what I'm hoping, like the whole nurse self-care movement sort of bulldozes its way into, is, like you said, assertiveness and the ability to be like, no, I'm not working another overtime shift. Like, your staffing problem is not my problem, you know, not to be cold-hearted, but just to preserve what little stamina I have left so that I can come in on the day that I'm scheduled. You know, it's sort of like a tough love thing. And I think I remembered I was going to say before that you made a good point about how nurses have this uncanny ability to see what needs to be done and then get in there and do it. It doesn't matter if it's like not my job or not your job. We had another interview recently, and he brought up a good point that nurses are the only ones that kind of do everybody else's job, but there's not really anybody else in healthcare that can step into our role. So that's sort of a responsibility that's put on us. But I think we can flip that. And like you said, there's enormous power in there. If we just have the ability to realize there's a whole lot of us. And if we get together collectively, we could probably make some changes, or at least make some noise about it, raise awareness, you know, because better nurses are better for patients. And that's really what everybody wants, including people that are looking at bottom lines, you know?
Absolutely. So, I think the sooner we stop looking at nurses and the system, more important, not we, then the system stops looking at nurses as vessels to fill gaps in the sky, and starts considering the person that's laying in the bed and those things. It's amazing how quickly I think that our healthcare system can correct itself. And just, you know, again, reiterating, we have to lead that solution. We can't wait for our politicians. We can't wait for lobbyists. We have to be that. And it's so important that we are.
Right. Yeah, no, I agree totally. We're sort of covering these questions as we're talking, but specifically, when you think of the word healthcare, what does that mean to you? Either personally or as a nurse or whatever hat you're wearing.
Yeah, you know, there are so many things that have been happening aside from even the pandemic that really like have shed a light on healthcare. And I think the biggest thing that I think of when I think of healthcare is that it's a right. It's not a privilege.
Yeah, agreed.
You know, things that have been coming down the, you know, line as far as access to care for low socioeconomic and for people that, you know, have those like identified social determinants of health that just make it harder for them to be healthy citizens.
Or participate in a system that's rigged against them from the
absolutely get-go. I mean, for people that, you know, are not able to, that don't speak English, and maybe, you know, they're refugees or immigrants, I've seen how difficult it is for them to receive any service, let alone good service. Right. And I don't even think it's fair to say that they fell through the cracks. I think it's much more than that. And, you know, other things like, you know, that idea of, you know, does healthcare have to cater to people that are transgender? I mean, that entire question to me blows my mind, because I know, looking at you, I've taken care of people that were not very nice to me and other people as well. That I worked with and heard about. And, you know, I don't think nurses get into healthcare to take care of people that they like, or people that they think are rich enough or entitled enough to get healthcare. We got into healthcare to take care of people. And it is one reason I'm so proud of the profession that I am, is that I think we are becoming so much more vocal on platforms like LinkedIn and things like Nurse Deck that are so insanely important, because it really is giving us that voice to be like,
Yes.
we don't like this. And
Right.
it's empowering us and other clinicians to step into more untraditional roles where they can be the ones that are leading the charge to make those adjustments to healthcare.
Right. I mean, that's our biggest mission, is connecting people that have things to say with other people that want to listen and that also have their own contributions, and then realizing that, like, collectively we have a pretty big voice here, you know, and sometimes it's hard to realize that when you're just like schlepping it every day, clocking in, clocking out, like barely making it home, you know. It's hard to know that there can be more than what you're experiencing at the moment, you know, I think.
Absolutely.
All right. Well, we kind of went over, so burnout, the issue of burnout. In another interview, the person I interviewed was like, I think that word needs to be canceled. He's like, we're so far beyond burnout right now. It's like a misnomer. We've been desensitized to that word. And I was like, you know what? That is, I mean, aside from the pandemic, you're so right. Like, we're just expected to like give more, give more, give more, give more. So what do you think would be things that leadership could do to address burnout, or where we are, which is like beyond burnout?
Yeah, I think that the healthcare system, and when I say the healthcare system, I think that we really have to, I hate to point fingers, but I think that we do kind of have to take a look at, like, who are the nurses that are burned out the most? And I would venture to say that the nurses that are working in skilled nursing facilities and hospitals are the ones that are burnt out, right? And again, the pandemic, not the one that has pushed it to a point now where we are seeing nurses and other healthcare workers, the suicide rate has increased insanely. The leaving of the profession, these things, like this is no longer a matter of, I don't want to go to work today because I'm tired. That's burnout.
Right.
I worked too much overtime last week. I need a break. This is not that, and I think that there's these, I think initially the most important thing that the healthcare system can do is to genuinely, pardon the phrase, cut the crap and stop stop placating the profession, stop placating other healthcare workers, and take notice to states and legislatures that have actually put in measures to take care of not even just us as a profession, but also the people in the bed. I mean, California and their mandates, there is literature that is supporting that is not only increasing nurse retention, but also the decrease in their adverse outcomes and other, really, things that we as nurses like fight and sit through in services endlessly to make sure that we're doing. That happens when you give fair staffing and resources.
Right. Yeah. Less words, more action.
And also, how are we going to, I hope this doesn't happen, but how are we preparing for the next pandemic? Because I don't know about you, but I will never forget watching nurses wear garbage bags.
Right. Oh my God. I know. Like, the images coming out and you're thinking, like, that's not happening near me. But of course, I mean, I live in Florida, so we all watched in horror New York in March of 2020. Well, now it's happening for us too. And it's, people are still just shocked. I'm like, do you really have to know someone that died for you to believe in this? Like, that's the attitude down here, is if I don't know anybody, it's not existing. And you're just like,
it's and I mean, and the other thing that's really happening, and I hope hospitals are paying attention to it, is these travel agents that are responding to, these crises and offering nurses these wages. I mean, I think that hospitals need to really take a look at things like those bonuses that some administrators are, insistent on taking every year, and also take a look at what we're paying our healthcare professionals. And that trickles down to our aides too. Like, I think it's really important. I mean, that we mention our ancillary staff and our EVS and all of those people. Those people have single-handedly been
carried us.
And will continue as we're, with this variant and whatever other variants come about, like, we'll continue to do that. So, I think that what's important is that we as a profession need to direct this exact question to the hospital systems and to the facilities and say, what are you doing? Because these agencies see what we're worth and are, and actually I've been seeing like some of these agencies too have some pretty decent like measures to like promote care with them and, are really like trying to take care of their nurses, and they have to pay attention because what are they going to do? Are they, it's going to go to a point where nurses are going to leave and only seek agency. And then what are you going to do?
And for people that can't be convinced that like maybe mixing business and healthcare is not such a great idea, because it can't be good for anybody's profit margin to be paying out like $10,000 bonuses for 2 weeks of work, But that aside from that, I just think that, there needs to be a change on so many levels, as you pointed out. Let's see. So platforms like NurseTech, we sort of touched on this a little bit. Like you said, it's these startups, these places that nurses can kind of come and have real voices and have sincere voices and people that really get it, and realize that you're not alone in all the things that are drifting through your head when you're walking around on the units being like, what the, what's going on here? Do you think that having a platform like NurseTech, like having resources all in one place is good? Do you like the ability to go to many different spots to get information, or is it?
I think it's important that, in this entire like world of like social media that we live in, I think it's important that we give nurses and clinicians a more focused platform. And I think that a platform that is also, kind of proactive in options and, and also just acknowledging what the profession is going through is incredibly important, because, it's great that other social media platforms have like backed the profession, but at the end of the day, those are not made by nurses. There's probably not many, if any, nurses even working there. So something like NurseTech, where we are genuinely, providing this platform and this avenue for nurses to, for one, like get a voice, but also for that nurse that is, not sure if they can do another shift. I think they need somewhere to turn to see like what other clinicians like them are doing to survive and grow and not, and not run from a profession that is so important and, allegedly so loved by our nation and trusted by our nation, right? Yeah.
Allegedly is rich. I know, seriously. What are your, so we're going to sort of switch gears here. What are your thoughts on AI, artificial intelligence in healthcare? Like, I know a lot of nurses feel threatened by robots coming to take over our jobs. But how do you think the practical application of this will impact nurses and their jobs in the future, or now, really?
Very, very excited about this question. I actually am doing my master's project on the importance of nurse inclusion in the increased usage of artificial intelligence in health.
Nice. Cool.
I myself work, I work for I mentioned Angle Health. They are, our goal is to be this health insurance 2.0, like the Uber of healthcare, where it's so much more than a health plan. We're like really wellness focused and using technology to better people's lives and increase their wellness. And I think the most important thing that we need to do, and this is something that it may not be the most popular answer, and I'm sure there might be some nurses that see this and they don't like it, but I think that it's insanely important that we as a profession need to stop complaining about technology innovation, and we need to flock to it, and we need to be a part of it, and we need to use artificial intelligence to increase our autonomy and increase our scope of practice and embrace it. There is that level of antiquated thinking in healthcare sometimes, and we as a profession are guilty.
This is the way we've always done it. Nurses are belly to belly. Can't I think like if you ask any nurse, like sorry to cut you off, that the one thing that drives you crazy on the floor is like, needy family members, like multiple call bells. I'm like, what if you had like a cute little robot that could go in there and A, entertain them, and B, just answer little questions like, when is my test going to be, when do you think I'm going to be going down for this x-ray? When, the little things that they want reassurances on, like that would free up your time, So like those little moments add up over a 12-hour shift. So I think so, right. We need to be running towards this, not like,
I think, like I was saying, like, I think healthcare in so many ways is very antiquated, but in other ways, it's one of the fastest, most innovating fields there are at the same time, which is it's a very odd juxtaposition. But, I'm going to do it's a call out, if you're a clinician that is that person that's saying, this technology is bad, it's going to replace us, you're kind of part of the problem. And there's no place for that frame of thinking in healthcare. And we have to be, it will replace us if we let us replace us. If we lead the charge in how we utilize it, it will make our profession better and stronger. And that's genuinely how I genuinely believe that.
And I think if we go in with a collaborative voice rather than an oppositional voice, we will have more say in things. I mean, because we all know, like, oh God, new technology rollout day, like today's going to suck. It's going to be like those poor IT people, but it's part of what we do. Like the more we can just roll with it and be like, we're going to have bugs, but we'll work through them. That's going to be such an important, I think that attitude shift, like you're saying, would help people take us seriously when we do say, this isn't working. Like this little robot over here, he's terrible. But this one over here,
this one needs to be on probation.
Right. So I think if you are using your voice for things other than just complaining about it, if you're trying to be part of like the collaborative solution, that probably might make for an easier transition to where we're going to head towards no matter what, in my opinion.
Innovation and change is an inevitability, and it's either, and I think it's very much that like keep up or keep out. And I think that it's really important that we embrace change and see the capacity it is to help, because, things on the end of care where, people are using artificial intelligence to predict like sepsis markers sooner and things like that. That is incredibly useful and beneficial information that empowers us. It doesn't hinder us. Centers for CMS, rather, they have an initiative moving forward that through a lot of other plans and providers, that has to be an initiative using artificial intelligence. And I think it's like that HL7 initiative to allow for automatic, like real-time prior auth processing.
I know all the things that drive you crazy. Like you're right. We could solve this problem for you.
And it's overdue and it's time. I mean, I know there's still health plans and even hospitals that are on paper, and that's not okay. So
true. It's so true. Mental wellness. Do you think that there are enough accessible mental wellness resources for nurses compared to like the kind of fake, in my estimation, toxic, like good vibes only, like that's not really making me feel worse, actually. Now I just feel judged. But
I think it's time as a profession that we recognize the fact that there's probably not a nurse that has any amount of experience that isn't carrying around some PTSD with them from what they do.
Seriously.
It doesn't matter what kind of a nurse you are. It doesn't matter if you're in ICU. It doesn't matter if you're in ED. It doesn't matter if you're a behavioral health. I mean, behavioral health is like the unspoken pandemic of this pandemic. You know what I mean? It's people's mental health is at a point that it may have never been before. And a lot of the avenues that we have, it's cute, but it's not real. And I think that, I would like to really issue like a challenge to some of those platforms out there that are really good for mental health, and even like Nurse Doc, like keep building, recognizing what and acknowledging what we know is true, and know that nurses have trauma and they're carrying it. And now more than ever, we need to collaborate and offer those sources that are evidence-based in dealing with like that situational trauma and processing it and learning how to deal with it, because we're a profession that is taught to deal with it because that's what you signed up for.
Right.
And
Rub some dirt on it. Yeah. Get back to work. Yeah.
Right. And there's, there's some semblance of truth in that, but at large, especially as of lately, we didn't sign up for this, and we didn't sign up to not be taken care of as a profession and given the arsenal of resources that we need to be successful.
Yeah.
And I think that the platforms like NurseTech, and then some of those like really great platforms that are geared towards mindfulness and all those things, start taking in mind that there is an entire field of professionals that really need that resource, and acknowledge what they're going through and put forth things that we already know about things like EMDR and CBT and DBT and those tactics that are very, very efficient in treating those things, and empower nurses and normalize treating your mental.
That's what I was going to say. I think just removing the stigma from it, because like you said, there's no nurse that's untouched right now, no matter what your role is in this. I think if you have a beating heart right now, you've been touched by this. So I think just talking about it is one thing, but also really talking about issues that sometimes, admittedly, nurses can be a little judgy on, like addiction within the profession, and taking medication for mental health and still being a nurse. Like, you can be bipolar and still be a nurse, but you're not going to tell anybody about that at work, even though 2 feet down from you, there might be someone going through the exact same thing. So,
and I think it's important to call those people out too. We need to call those people out too.
Yeah.
I mean, that's, I think, it's great to be pro nurse, but it's also okay to admit that there's people in our profession that bring a toxicity to it. And that level of thinking is very toxic, and it promotes that whole idea of eating your young and developing this attitude towards people that are mentally ill, that they don't deserve the same level of care as somebody who's really sick. Like, it's not. No, I so agree with you.
I mean, I'm watching it come out, and there's a little bit of different factors at play, but like, the people that are coming in that are unvaccinated, that coming in with COVID and, not doing very well, that's that's a hard thing for, I think, anyone to deal with, but nurses in particular. It's incredibly frustrating, but to approach it as, not with that judgment lens, but with some compassion. And I was listening to a podcast the other day, and a nurse was speaking, and she's like, if we can leave less room for judgment, we have more room to love. And it's not, I mean, that's a cute little quote, but it's also very true. If we spend all of our energy, like, oh my God, can you believe, all of that, there's not going to be enough energy to actually give with these people what they really need. So
it's a very exhausting way of thinking to spend your time in a negative.
Yeah. Right. Yeah. Which, I mean, harms everybody, your coworkers, yourself, the patient. Yeah. Let's see. I think we're wrapping up here. I've got one more question for you, and then anything else that you want to throw in there. But again, the concept of like community and nurses community, how do you think platforms like that are online? I mean, we're virtual right now, even though we're speaking in real time. Do you think it's hard for nurses to have their own community if they don't feel like they have it at work or in their, accessible reach, and can that be achieved through platforms like NurseTech?
I definitely think that is the case. I think that it's really important that, platforms like NurseTech really push forward and continue to be very heavy-handed in their marketing, and their, labeling themselves as being a resource, because community is so important. And again, I mean, I've worked in some hospital settings that were the best culture I've ever worked in. And I have worked in some truly toxic environments that
same.
I cannot imagine having to go back to. And I mean, I think what's important for places like NurseTech, and, I try to hold it from a clinical element, like our company too, is, offer that hand out and show that there is more people like you, and that, if things are really bad for you right now and you don't think that you want to be a nurse another day, just look at what else you can do as a nurse and where else you can move to have a truly profound effect on the system as a whole. Being at the bedside is an amazing gift. It is an amazing work. There's times I miss it every day. The adrenaline, the success when you see somebody who is so sick walk out the door, it's an amazing feeling.
Right.
And it's that like you'll take with you forever. But what's also an amazing feeling is doing something to shake up and turn this absolutely broken system on its head. And nurses have the ability to do that. Nurses do go to Washington and lobby. Nurses do those things. So use that frustration to run into this fire and put it out. Don't run away from it. And that's and I think it's the responsive. And I think that's what I love about what Nurse Doc is doing. And I hope that you continue to like challenge your platform to do that, because I think it's really important for platforms like Nurse Doc to be that message for those nurses that feel like they don't have community, and empower them to show them what they can do, you know?
Right. Well, I love that. I love that whole channel the frustration and use it to move forward, not to pull back and away. I think that's such an important message. So
we all learn how to feel our hate fire in nursing school, right? Like you don't get through nursing school and you don't learn how to like channel that frustration.
Right. Exactly. I know. It's a skill you didn't even know you were learning until you needed it in real time. That's awesome. Well, anything else you want to throw out there to the nursing world at large? I feel like we've covered a lot of good ground.
Yeah, no, I think, thank you so much for having me. And honestly, I would love to continue having these kinds of conversations, and anything I can do to help with Nurse Tech, I think it's incredibly important. And I think that you're helping change the world, and that's a super important thing.
But no, that's awesome that it's being received in the same, I have small children and my brain is a little Swiss cheesy in the morning.
Well, you know, it's okay.
The same vein that we're trying to put it out there. But I really appreciate your time. I know you're super busy. Good luck with your last semester.
Thank you.
Like you're working on